Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. And where are we taking calls, Dr. Darrow?
Are we taking calls? You bet we're taking calls at 866-870-5752. You're giving me a call right now. I'm going to send you out a free copy of Stem Cell and Platelet Therapy, Regenerate, Don't Operate, a couple 100-page book with about 256 studies about how regenerative medicine of platelets and stem cells can heal your orthopedic issues, your musculoskeletal pain, and how surgery is not the best answer today. Of course, it's the only option with many things that are emergencies. You break a bone, it's sticking out, you get a surgery right away. But for most of the surgeries that I see being done, they should not be done in the first place. And thank God the culture is changing about that. And there are more and more orthopedic surgeons who are learning how to do regenerative medicine. So we were talking to Marv. Thank you for calling in, Marv. And we're talking about the fact that you're having what you're calling a sciatica type thing in your right hip. And the right hip is a very confusing area because it might actually be your hip joint. It may be an enthesopathy where the gluteus medius muscle attaches to the pelvis. It may be the greater trochanter, which all the muscles in the butt attach to. There's just a lot of stuff going on there. Maybe the iliolumbar ligaments. It may be the thoracodorsofascia. It may be the quadratus lumborum muscle. So all of these things could be your issue. The fact that when you loosen up after you wake up, the pain goes away is a really good indication that I can probably help you heal. Like I tell everybody, and I get emails from all over the world every day saying, can I please send my x-rays or MRIs or CT scans so you can tell me if you can help me? I have to always respond by saying the only way I can tell is by using my hands and touching the body and finding out where the pain generator is. And that applies to your situation, Marv. So I think you're doing pretty darn good for what's going on. But if you want to find out what's going on, call the office, set up an appointment. 800-300-9300 is the office number. I'll repeat it. It's 800-300-9300. And if you want to get in soon, just tell them you were on the radio and I said you can get in immediately. And God bless you, man. I appreciate your call. Do you have any other questions?
No, that's it. Just wanting to see, how severe or how to treat this properly without an operation.
Well, I don't think you need an operation from what you told me.
Okay.
I mean, you don't have any emergency. You have no emergency going on, and too many of these surgeries fail. So the odds are not good for you to get one. But again, I can't tell.
That's my concern. Yeah, I don't want to get cut if I don't have to.
Yeah, and I did it once on myself. I had my boss cut my shoulder when I was in fourth year med school. I had some pain, and it was an abomination. I don't think it was his fault. It's just what happens with surgery. I still love the guy.
Well, I thank you, Dr. Darrow, and I'll call your office and see what they can do with me in terms of an appointment and time.
God bless you, man. Yeah, and if you have any problems, you can just email me directly at the website at www.lastemcells.com, and I'll get you right into the office anytime you need to. I know you're a truck driver, so you have certain hour requirements, so I'll make it happen for you.
Shall we go to Wendy?
Wendy, Dr. Marc Darrow, your heel is hurt. Both of them or just one?
It's both of them. Can you hear me okay?
Oh, yeah, you're doing great.
Okay, so it's both heels, but my striking foot is radically worse.
Okay. Are you right-footed?
I am.
Do you play soccer?
I don't. I'm not an athlete. The only additional thing that I've started doing is I have a 7-hour pottery class at
Okay.
a local community college.
Yep. Okay. When you said striking foot, that refers to soccer. That's why I thought you might have been. Yeah, the striker is the guy that the striker is the guy or the girl that kicks the goals.
Oh, yeah. No, I was just thinking about which foot I predominantly lead with.
Yeah, I hear you. So my daughter was a striker at Colorado College. She was on the soccer team. She just graduated. She was the captain of the team, so I'm so proud of her. And yeah, and she's had a lot of foot, ankle, knee problems through the years that I've been able to help her with, thank goodness. So anyway, is it the bottom of your heel that hurts or the back of your heel?
It's the bottom, and it's like an ice pick is coming up through the bottom of both heels. It's worse in the morning.
Yep.
And the pain was so bad that I actually went to the emergency room, and he ruled out plantar fasciitis because he said that he wouldn't be able to manipulate it the way that he did, during the exam if it was plantar fasciitis. But then the general practitioner said it is plantar fasciitis because she just decided that it was because of how it's worse in the morning. And since I've already had x-rays, I've already had an EKG to rule out heart stuff because my ankles were also swelling. Okay. I don't know if the ankle swelling has anything to do with this or not. And then the other variable is I went from 1,000 square foot apartment that was carpeted to my parents' house, which is much larger and hardwood floor and tile throughout the whole house. Okay.
Well, I don't know if you were listening to the show before, but I was talking to Marv just before you, and I told him that I can't tell you much over the phone in this situation until I touch the spot. And there's one spot on the bottom of the foot where the heel attaches to the spring ligament. That is where the issue is if it is plantar fasciitis. If I put my thumb on it and you punch me in the face, then I know you've got plantar fasciitis. Do you know what I mean?
Okay.
Nita, you're supposed to laugh when I say jokes like that.
I'm just ready to be done with the pain right now. They have me on 600 milligrams of ibuprofen 3 times a day.
Get rid of that. Get rid of that. Get rid of that. You could bleed to death from that.
I know. It's a problem.
Yeah, you don't want to be taking that. And it's not. You said it's not helping, so don't do it. Don't do things that don't help. I have people that come in every day. They're on so many different medicines, and I go, "Does that help?" They go, "No." I go, "Stop it then." So anyway, I need to examine you. It'll take me 2 seconds to tell you what's going on. And if it is plantar fasciitis, I inject that with platelets and or stem cells under ultrasound guidance, meaning I put the probe of the ultrasound on the foot, and I can see exactly the pinpoint, the micromillimeter where that spot is, and direct a needle toward it, and then heal it up. They heal really well.
And where are you located?
I'm in West LA. I'm on Wilshire across from UCLA, across the freeway from UCLA.
Oh, okay. So say no more. I was just really crossing my fingers you didn't say like New York or Alabama or some other place that's not in California.
Well, honestly, Wendy, I have people that come from all over the world to see me.
I can see that. I'm driving my mom's car, and for whatever reason, her radio station was tuned to this radio station. I'm not familiar with it, and I was listening to the gentleman you were helping before and typing into my phone the different resources you were sharing. I'm like, this is like all a happy accident for me to find my way to you, because I've been literally like praying about like what is going to be a solution when I've got an ER doctor at Kaiser saying it's not this, the general practitioner saying it is this. I'm still in pain. My podiatrist appointment is Monday. I'm running through $15 copays at Kaiser like it's nobody's business.
I wouldn't. Here's one thing I would not do. The typical treatment for this is to get a steroid injection, cortisone type. Okay, do not do that. That actually weakens the tissue. It may feel good for a while, but then generally it's going to come back raging at you later.
Don't want that.
No. It's a quick fix, short term. It's like a Band-Aid. So I always call it winning the battle and losing the war. So
that makes sense.
You leave the office and go, wow, this feels so great, because there's lidocaine mixed in it, local anesthetic. And if they do guide it properly with an ultrasound, they'll hit the spot. But then the problem is later down the road. And some of these actually tear because of steroid shots. So I'm not a fan of
we
steroids.
don't want that.
No, I'm not a fan of steroids.
Well,
Go ahead. I'm sorry.
well, it's your show.
No, I'm here to have you talk.
But what I'm wondering is between now and whenever I'm able to get in to see you, so that if I'm not taking, 600 milligrams of Motrin 3 times a day, and like the regimen of ice, the regimen of elevation, trying to stay off my feet.
No, that's not how you
basic
fix
stretches, like what should I be doing?
What you should be doing is writing this down right now. Do you have a pencil with you?
Okay.
The phone number to my office is 800-300-9300.
Okay.
Tell them you were on the radio with me, and I said you can have an appointment whenever you want.
Okay. Thank you.
And if they say, I'm sorry, we're too busy, go to my website and email me directly. Your phone number will be there, and I will call you up and set it up myself. And the number to the website, or the www.lastemcells.com. So it's www.lastemcells.com. And anybody can email me through that. And if they have an issue that's an emergency like yours and you're miserable, I'll get you in immediately.
Yeah. Thank you. Well, and then I can't help but ask, because I'm 6 feet tall. I weigh 215. I'm like, imagine a woman who's 1/4 Viking. That's me.
Yeah, perfect.
But my dad is 6'7", and he's got like pronated feet and gout and all kinds of stuff that is not ideal, that he's treating with pharmaceuticals. And I know there's got to be a better way.
There's better ways. Medicine is not the answer. We need medicines for certain things. There's no question about it. But I'd say 90% of the medicine that I see patients taking, I want to get them off of. And there's ways to do it naturally. Vikings are cool, but they do have problems being that big.
Yes. Yeah. It's true.
But I get I get a ton of Vikings in the office. I really do. They're very prone. Oh yeah, tons of them. Tons of Northern European, giants. They're not really giants. And you know what? We have a new race coming in right now. All of my nieces and nephews are big. And if you've watched, I have a grandson who's 6'5". My son was 6'3". I'm only 6 feet. But most of my nephews are around 6'4", and they're getting even bigger. Their kids are getting even bigger. So the Vikings are coming back.
What do you mean there's a new race coming in?
I don't know what I mean. People are getting bigger. That's all I mean. Yeah.
And you don't think it's from all the hormones in our food?
I don't know the answer. People say that. They say it's because our food is better, but I had 2 babies that were 9.5 pounds. So, I don't know. I don't know what's going on. I just know it is going on. And if you figure it out, you call me and let me know. I'd love to find out the answer.
Me too.
But anyway, your size is perfect. 6 feet, 215 is good. You probably have bigger bones than the average person, and that's fine.
Yeah.
It's not a big deal. And we can still help your feet, so it's not an issue.
All right. Thank you so much.
Wendy, God bless you. I appreciate your call.
Thank you, Wendy.
Ramona, we're going to go to you in a second, but I just want to say this is Dr. Marc Darrow. I do stem cell and platelet therapy for orthopedic injuries or arthritis or overuse. And if you want to talk to me live right now, we still have a few minutes left for callers. And the number to the studio is 866-870-5752. If you call me right now, I'm going to give you a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I'm going to mail it out to you for free. It's a pretty hefty book. It's a couple hundred pages. It's got 250 studies on how regenerative medicine works, why it works, and why surgery is on its way out for these types of injuries. And I fight with my orthopedic surgical friends. I tell them they're hurting people, and they tell me I'm not helping anybody. Well, I know I'm helping people, and I know they're hurting people because I get so many patients that heal, and I get so many of their patients that are actually injured from the surgeries and that didn't need to have the surgery to begin with. I'm not putting down surgeons, believe me. They do the hardest work in medicine. It's just that most of these surgeries, I think, shouldn't be done. There's studies now, the VA, Veterans Administration, did one on knee surgeries where they're not even allowing most of them to be done anymore because patients get down the road. It's the same if you have a surgery or you don't. So why do a surgery and have the chance of getting worse? So Ramona, it's your turn. You have lower and upper spine pain. What happened?
Yes. Hello, Dr. Durr. Thank you for taking my call. My mom is, I'm actually calling for my mom. She's scheduled to have an MRI for the examining of the upper and lower spine. I'm skeptical about having the MRI, but
MRIs don't hurt anybody. It's just magnetic energy, so that's fine to get it.
Yeah, so I wanted to have an opinion what you think the challenge might be.
Well, I would, if she's set to get the MRIs, I would get them. And the reason I like MRIs, I don't like them for diagnosing issues. I like them to find out that there's not some kind of a cancer or something weird.
Yes.
So I typically, even if I look with my ultrasound and I don't see something, I still may end up getting an MRI for a patient because I have found cancers, I found cysts that I couldn't see, I found things that have impinged on nerves, and I'm glad I did it.
Okay, so...
So it's not that I don't like images, I do like them, but I don't use them to diagnose. I use my hands to diagnose.
Okay, so you would recommend it, but you couldn't possibly guesstimate...
No, I don't guesstimate anything until I touch somebody.
Okay.
Got to do an examination. And unfortunately, most of the people that come in with failed surgeries, people that had a surgery that went bad, they never had a doctor touch them. They had an MRI or an X-ray, and they were operated on because of that. And that's not, to me, it's not good medicine. To the doctor, it is. You know, we all have different opinions, and I don't ever put down other doctors. They put me down a lot. You know, they go, this can't work. Well, I've been doing this 25 years. It works.
Yes, I agree with you.
You know, I've injected my own knees, shoulders, elbows, my wrist. I've had other doctors inject my neck and back. Everything I've done in regenerative medicine has worked every single time. Sometimes it's taken more than one treatment.
Way to go. Well, I thank you for taking my call.
God bless you, Ramona.
God bless you.
Shall we go to Esteban?
We're going to go to Esteban in 1 second, but first, Esteban, I want to give out the phone number so we get more callers. Mona, we're going to get to you too. The number to talk to me live right now is 866-870-5752, and the number to my office, if you want to call there and get more information, is 800-300-9300. If you want to watch these procedures on my website, videos, go to www.lastemcells.com. Esteban, you've got low back pain. How long has that been going on?
Well, doctor, it's been going on for over 20 years.
Okay.
What I know that I have, I think it's about 3 or 4 lower herniated discs.
Okay.
And
well, let me cut you off for 1 second. I just want to say something. I have herniated discs in many places in my spine, and I don't have pain. So don't think because you have a herniated disc that is the pain generator. I have had pain, but I've injected it and gotten rid of it. And it wasn't the herniated discs that were the pain generators. So we got to be careful not to end up getting a surgery when we have a diagnosis from an MRI or an X-ray. And do you have any pain?
No, I never did want to have surgery.
I don't blame you. Those surgeries are nasty. Do you have any pain down your legs, or is it just localized back pain?
It's in my lower back, and then sometimes, I can even walk or stand for a long time.
Yeah, but you shouldn't drink so much.
5 minutes.
Neither, you're supposed to laugh.
I don't know if Esteban heard your joke.
I know. Anyway, Esteban, I need to touch your back. I can tell you in about 1 minute if I can help you by palpating or touching the areas that you're having pain. Most of the time, low back pain, I can help it.
Okay, can I get, how do I,
Yeah, I'm going to give you the phone number to the office. It's 800-300-9300. I'll repeat it for you. 800-300-9300. Most likely, it's just going to be some injections.
Okay, 800-300?
800-300-9300.
9300. Okay. 800-300-9300.
Yeah. Most of the time for low back pain, we just inject platelets and or stem cells to heal up the areas that are the entheses, where the ligaments, tendons, muscle attaches to the bone. And it's, in a sense, it's like welding. It's not welding, but it's the idea of just growing the tissue there and stabilizing it and getting rid of the pain. You can also go to the website www.lastemcells.com and watch videos of me injecting the low back or other parts of the body. See if you think it's something you want to do.
Can I call right now to make an appointment?
Yeah. You can call. There's people there. And we're going to send you out a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Okay? God bless you, man. I appreciate the call.
Thank you, Esteban. Appreciate your call.
I'm going to give out the phone number. Then, Mona, we're going to get to you about your sister's hip. The phone number right now to talk to me live is 866-870-5752. I'm going to repeat it, 866-870-5752. We also do these procedures on the face to grow back the collagen and make you look younger, and on the head to thicken up the hair. So regenerative medicine works all over the body. So Mona, Dr. Marc Darrow, your sister's hip bothers her, or does it bother you?
Yeah, she. I think about 10 years ago, she fell backwards off her porch, and it's been bothering her since. In fact, she was here 5 years ago. She's from Michigan, and I tried to talk her into going to see you because I've listened to your show, but I think she was just hesitant toward, like if she knows stem cells is expensive, and she ended up going back to Michigan and going and getting stem cells over there.
Okay.
And there was no improvement with her, so I said it doesn't always, you have to go to the right person, and the doctor, there was improvement in your cartilage buildup. But then she went to another orthopedic surgeon. He said there's absolutely none there. So she's here visiting. She's here in Palm Springs right now for about 2 months for the winter. I'm trying to get her to go to see you because I just went to see her, and she walks. She's a young 71-year-old, but because of this hip thing, she walks with her legs about 2 feet apart.
Okay.
And, needs help like getting up and sitting down, and she can't sleep in a bed. She has to sleep in a chair, and I'm thinking, oh my gosh. And her neighbor, who just had a hip replacement, there were two of them. One was raving about it, and then the other one, she hadn't heard from her. And so right after Christmas, she said, I didn't want to tell you, but the surgery went horrible. They broke my femur bone. And
oh, my God. So listen, call the office and get her in. It's 800-300-9300. Or just go to my website and email me from there. It's www.lastemcells.com. And I'll get her in right away because she's going to be here for a while. We want to be able to take care of her. God bless you. Thank you for calling.
Thank you, Dr. Darrow. Thank you, Alex and Suzette, and to all the callers and listeners. And we will see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. right here at AM 870 The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.